With the YouTube Buffet plan from MTN, you can enjoy over 10 hours of Nollywood content made for you. Sharply dial *312*800# to activate the YouTube Buffet plan from MTN and start enjoying. YouTube made for you.
Get ready to supercharge your life as we dive deep into the latest trends in health, expert insights, and practical tips to help you live your healthiest and happiest life. Catch the rhythm of wellness with Vic Riches on Solutions Clinic every Monday from 10:15 a.m. to 11 a.m. on Solutions 93.9 as we journey into the world of nutrition, fitness, mental health, and other holistic approaches in the world of health. Don't miss out on the valuable information that can transform your well-being, because a healthy life is your ticket to a wealthy life.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM.
Another edition of Solutions Clinic, where we get to talk about everything and anything health. Exactly 17 minutes gone past 10. I trust you had a great weekend and you have continually made your health a priority. All right, I did mention earlier that we're going to be talking about sickle cell awareness this morning, and by way of introduction, sickle cell disease is a genetic blood disorder that impacts the shape and the function of the red blood cells. It is a global concern that knows no boundaries. It is estimated that millions of people are living with sickle cell disease around the world, with thousands of babies born with the condition each year. Beyond the physical challenges, individuals with sickle cell disease often face social, emotional, and economic hurdles. Discrimination, stigma, and limited access to healthcare are just a few of the barriers they encounter on a daily basis. However, amidst these challenges, there is hope as advanced medicine and research and treatment options have been improved, with an outlook for individual living with sickle cell disease. Joining me this morning is Dr. Chukwuma Okoli for more analysis on this. Good morning to you, Doc. It's great to have you join us.
Good morning, and thank you, our listeners.
All right. So let's start off, with the continuation, or how do I say this? Let me use the data that I have. Every day there's a baby born with sickle cell disease,
yes,
even with the awareness that is set to go around the world. Why do we have this still prevalent?
Thank you. The reason is still the ignorance that persists in the heart of people. A man meets a woman, and the next they talk about is dating, and the next they talk about is sex, and then the next thing she takes in, and boom, the next thing she delivers, and without even bothering to ask questions. Salient questions should be asked. I think if people learn to follow things by proper protocol, these things will be avoided. Despite the awareness, things like this persist. And I think the problem is there in the foundation. If certain things are put in place, that is, you make attempts to educate a lot of people. We still have a lot of uneducated Nigerians. We have a lot of secondary school dropouts. We even have people that did not finish the secondary school who dropped out because they can't even afford education. Now it's getting to the point of they can't afford to eat, let alone go to school. Now somebody who can't afford did I say three? Two square meal? Okay, somebody who can afford 2 square meal,
now
quarter. You want the person to go to school to understand genotype. You ask them, what is genotype? Huh? Kilokwe? Geno kini? That's it. So we have a problem. The problem is the foundation. And because the foundation is wrong, you see a man starts going in with a woman, boom, she takes in. And then the next thing she puts to bed. And probably after naming, after a couple of things, and suddenly you now notice maybe the hands of the baby and the legs are swollen. You now go to the hospital. And probably after bouts of treatment and all, the doctor just decides to ask, Ma, please, what's your genotype? What's your husband's genotype? And boom.
They don't know.
They don't know, obviously. You now do, after 6 months though, you do the genotype of the baby, and boom, we have a sickle cell anemia case before you. And that is how you keep having people maintain the figures or probably even increase the figures. That's because the foundation is wobbled already from the scratch. If people know the right thing, if they know the right status, then they know who they go in with. And I think it's better that way. It took a while before I could settle down because I know genotype. I know mine, and I knew what I could go for. So it became a jam question. It became the interview heat question. What's your genotype? The moment you're telling me anything that has an S in it, boom, that's a red flag sign. If you like be Miss World, I'll just, throw my head down.
No, but
and
they deserve to find love too, don't you think?
Yeah, they do. Of course. It's bilateral. Like the women deserves, the men does, but please, let's love with our brains. And not give birth to a child who would look at you and say, Daddy, Mommy, why? Of course, nowadays, the internet is our beck and call. People will just browse and realize, if both of you had asked yourself the right questions, you shouldn't have given birth to me. So why did you do this to me?
Right, fair enough. Essentially, I think that genotype should be the first date question, as a matter of fact, because I think the mistake that happens with situations like this is you're assuming that what you have with this person might not be long term, and before you know what's happening, you guys are already going and going and going, and at the time you're asking the question, you're already so invested in it emotionally.
Yeah, I think before the love comes, the question should be asked. I will believe so strongly. Before love
Some
comes,
ladies will find that offensive, but
that's the point. But let's face it, you rather take offense at the fact that I asked you of your genotype, because if I am AS, I need to know your genotype before we start getting too close. I mean, yes, I am AS, and I'm proud to say it. So if I'm coming close to you, and then I know I want to have something long with you, I must know. The moment you tell me you are AS, oh, fine. I cross my mind. We can only be friends, and I will monitor and not allow you to go beyond that. For crying out loud, unless we know we just want to play with ourselves and walk away.
fair enough.
And things are not even so available for one to play. Which
At all.
Never choppy they play.
Speaking of these babies, I'm really concerned about when they start even showing symptoms.
Yes.
Is it at the early stage that you
sir.
see?
Yes,
Oh,
sir.
how old?
As a matter of fact, as early as 2 months.
Wow.
In fact, sir, I've seen a case where I think it was the first week of life. This child was born with 57% blood level. Fantastic. And then came back the next week, 34. And the shocking part was there was just mild jaundice. It wasn't like because when blood cells break in large quantities, there is jaundice. So I started asking this question: what happened? I couldn't even do anything about it. I couldn't do a genotype because you need 6 months of life before a genotype is done. We had
Before a
manage-
genotype test
Yes,
is done.
it's done because there's something called hemoglobin F, hemoglobin A, hemoglobin A2. The fetal genome on the blood will still be in the baby's bloodstream, and that's from the mom, will still be in the baby's bloodstream for the first 6 months of life. So after 6 months of life, you can now do a genotype because by then you have the genome of the baby itself only for the baby. And at that point, you can do a genotype and then find out. So all we could just do was to manage it conservatively. Much later, we transfused a couple of times, and then he was stable for like 4 months. We gave the do's and don'ts because we saw the hand and foot syndrome. We saw all those symptoms that came up. So we managed, and then we counseled her. And then after 6 months, I told her, Madam, face it. Go and get this thing done. Now she already knew, this is my error. Go get this genotype done. And when it was done, it was just snapped and sent to me. So they zoomed that S and S. They zoomed it and sent to me, and I clicked on it. I just closed my phone. I'm like, oh my god! So this is another SS.
Wow. I think that the major concern for a lot of people is they don't even understand the different variations of the genotypes. And when I was still in school, I only knew of AS, but today I hear like different, there are different variations to this. But before we go into that, before you talk about the variation, I want to play this video that, I saw, and I want us to all listen to it and hear what this couple had to say about their decision.
What song would you say represents our journey? And why is it special for us?
Ooh, it's gonna be Simi's song. Pretty sure Shay and I both sickle cell carriers, so there was a big conversation of to marry or not to marry. To the glory of God, our kids are fine, and of course we took the right precautions. So don't do this at home. Don't
Yeah,
do
we
this.
did a lot of research, talked to a lot of doctors before we made that decision, and
Yeah.
took protective measures to make sure we had very healthy kids.
Yeah.
But yeah, love don't care, man.
Don't gamble with your kids, but love don't care.
You know what? They have money.
Obviously, because I did see what it cost to do what they did.
You get me? Lots of precautions. They saw a lot of doctors. Nowadays, you have to pay for consultation. You want to consult me, whether on phone or physically, you have to pay a lot of money. So now, you go see people who are specialists in this regard and then take precautions. These precautions run into millions, if you want to know.
Yes, I did. I think
And
over
then
1 million.
You heard the statement. Don't
Gamble with your kids. But what they did was a gamble. It was a serious gamble, to be fair, because I also read that it's almost impossible. It's not guaranteed that it will work out health wise, medically. Is there 100% guarantee that even if you do what they did? But that's not even why I played the audio. The reason I played the audio is, some people took to social media and said this shouldn't have even made it to social media because it can be very misleading. Some people, even with the money, they'll start considering, doing such a thing. And even without the money, they still, these guys did it because they are influencers on social media. And this video is already viral. So let's start off with understanding the different variations of, genotypes.
Thank you. The commonest is the AA genotype, AA. Then close to it is the AS. So we have the A, we have the S, we have the C. The C is not common. Majorly we have the A genome, the S genome, and then we have the C. So the commonest we have are the A's and the S. So when you have two people who are AA get married, all their children will be AA. Now you have an AA getting married to an AS who is a sickle cell carrier. Now you will have them give birth to one AS as a child, so to speak, from the tree. But once you have two people of the same AS genome getting married, then they will have AA. They will also have an AS, and then a high possibility that 50% of their child deliveries will be SS. And that's actually what they were talking about. They had healthy kids. Healthy kids means, of course, the kids are AA. They took precautions. They did a lot of stuff with the doctors in order to get and choose the healthy babies. But like they said, I'm also joining them to say, don't gamble with your kids. Amen. Don't gamble with your kids because it could be dangerous. It could be dangerous. So now, this is the reason why I said you should not, if you are AS and you're listening to me, please, here is my humble advice this morning. Marry an AA genotype. Don't marry anything other than that. Now we have the C genome, okay? We've seen people with AC. Now we've seen, and then you see when AC, if you are AC, now let's just say, if you are anything aside AA, that is, if you are AC out there that you are paying hospital bills past 72 hours, and I must tell you, it's not a joke. So if you're out there paying hospital bills, I pray for you that the Lord will provide. And I pray the person you're paying for will not fall sick frequently. And this morning, let me quickly just say, please, if you know that you are a blood donor, you belong to a blood donor group, please, it's time again. Pay a visit to the blood bank and donate. Thank you. God bless.
All right. Another thing we must achieve this morning is to let people understand the consequences. You've mentioned one of which is visiting the hospital very frequently. But what some of these couples don't know that they're doing to their children or their child is the mental and emotional damage and physical damage that this does to them. I have heard, I can't speak of the experience, but I've heard that, the sickle cell crisis can be likened to a near-death experience. I don't know what that feels like. I've had, a sickle cell warrior come on the show, and she described it sometime last year, and it was not a good thing to listen to. For purpose of reiteration, how does it happen? I know you don't have an experience too because you're not one, but you've probably seen them, in that situation. How is it like?
Okay, yes, I know a couple of people. I have managed myriads of them, and some personal experiences, though. There is this mosaic group who are not sickle cell anemic patients, but they have a higher percentage of the sickle cell genome in their body. And they go through the bone pain. I tell you, the bone pain, you know how it feels like when your bone feels like it's soft? Bone that should be hard is so soft you can't step on the ground. You're limping on one leg. The second leg you're even managing to walk with is hurtful and painful. You wake up in the morning, you feel pains in all your joints. The pain is so much it takes sleep away from you even in the evening. The worst part is you're a busy man. You go out in the morning to work. In the evening you retire to the bed to sleep and you can't sleep because of bone pain. And then you roll up like a basket that has been stuffed up in itself, and then you are giggling in pain, and then you're crying and begging for someone to give you a pain relief so you'll be able to sleep at all. And then some of them, their eyes are almost always yellow because they keep hemolyzing. And then I used to beg them, drink water. I'm coming again, right? Drink water. There's nothing you stop me from. Hey, this is it. It is water. Drink it every day. And of course, you know now that if you belong to the sickle cell group, you have to drink water. I know someone who does as much as 8 liters per day just to keep, because you're taking care of your kidneys too. If those cells should break in large quantities, the myoglobin from it can block the kidneys. The hemoglobin too can block the kidneys and cause a kidney failure. And that's why some of them die suddenly. The painful part is from the experience of the pain they've been through, some become stubborn. Some feel like, I'm tired. Well, I'm tired. Whatever wants to happen, let it happen. And the next they grow sick and they die off. The first person, it's something better imagined than experienced. I'll still say it again. Please drink water. And then if you know your genotype, please, before you go deep, find out the genotype of that person you like before it becomes the love and before it becomes korikosu.
Fair enough. I mean, I also lost a very good friend in secondary school due to, sickle cell as well. And, it's really heartbreaking. I mean, he had like series of episodes in class then, and it was not a sight to behold at all because you don't even know how to help them.
Yes.
That's even the challenge. You don't know how to assist them in that situation. So this is a very sensitive topic, and when I saw this video that I played, I was really angry, to be fair, because why would you do that?
Yeah, the flow of flow of funds is not equal. It's not uniform. It's not uniform. So it's not easy to say don't try it. I mean, you guys are influencers, and I know social media influencers have a lot of money. They get paid a lot, So you can't compare yourself to the average man who listens to you and says, "Oh, okay, you're able to do it." And me and my girl too, we can try it. All right, let us go. What do you want to go and see? Who do you want to talk to?
So let's even talk about people who are already dealing with this. In cases of what triggers these crises that they have.
I was waiting for you to ask that question. Let me try to explain the physiologic or medical language and try to make it plain. Now, this is broken down to the red cell, and that's why I love your definition. Started with the blood disorder. Yes, it is. We all have veins in the body. Our veins are smaller than our arteries. We have the smaller capillaries. These are even smaller than the veins. When the blood is flowing through those places, now the blood cells, they form this, they call it margination. They manipulate the size, the shape of the cell so it can go through those tiny capillaries. That of the people with the sickle cell doesn't have that ability to manipulate its way or maneuver its way easily. Hence, it forms a sickle shape and then gets destroyed in the process. So you have thousands and thousands, millions and millions of cells getting destroyed while trying to go through the capillaries, and then the cells get destroyed, and then the person becomes pale. Now, aside from getting destroyed, they also block those capillaries. Blocking the capillaries means there is no blood flow beyond the point of blockage. Now, when there is no blood flow beyond that point of blockage, it gives rise to what is called ischemia. And ischemia is when nutrients, oxygen and nutrients doesn't get to the tissues beyond the point of blockage because the cells were not able to maneuver their way well. And at this point, patients start having pain. And with pain, they come with a shortage of blood because the blood cells have been destroyed in large quantities. So that's anemia that comes with it. So the pain, and it happens in extremities, the legs, the hands, okay, and then they start having lots of pain there. Another thing is that the spleen, of course, gets enlarged, trying to pull those abnormal cells, trying to store them. Now you're trying to store abnormal cells, your bone marrow is not producing enough to replace the one that you have pulled out. The spleen becomes very big. At some point, they even undergo what is called autosplenectomy because of the whole process. Out of this whole thing, the cells around the place dies of causing excruciating pain. A lot of times, some of them who can afford it go for a hip replacement. You know, most of them you see them with big tummies, and that's because of what the liver and the spleen that are massive. Then some of them, just any little sickness like this, they need blood transfusion. I have a friend who, the last time she was admitted, her PCV was 17, and she took 2 pints of blood, you know, and their life depends on all these things, and you just have to advise them, please drink water. Now, what will the water do for you? The water constantly dilutes the blood so it can flow easily, and then help the cells to manipulate their way, or maneuver rather, their way into those tiny, tiny capillaries, and reduce the rate at which they are being destroyed. Another thing is folic acid they take. That folic acid is needed for blood cell formation, because for them, blood has to be formed on a daily basis, because cells are being destroyed also on a daily basis. The prayer is that the level of destruction will not be as much as the level of formation, so that the blood level can stay on a particular comfortable position. So these are just the things that happens in a nutshell.
I hear they're also susceptible to, like, disease, infection,
Yes,
and whatnot.
fact,
So that's why.
Yeah, this my friend now had 2 pints of blood. The white cell count was about 25,500. She had to take antibiotics for like about a week or thereabout. And yes, they are susceptible because the immune system is in shambles because of the fact that the body is so involved creating and producing red blood cells more and more and more to keep. So they are also prone to infection. The spleen that is busy pulling off, can also pull off unnecessary things, and the system is just in a chaotic state, and one has to be careful. Anemic heart failure is just by the corner, so yes, their heart can just go into failure because it doesn't get enough blood, or the blood is not rich enough to pump, and that can create trouble. So they are at risk of that as well.
All right, well, you're listening to Solutions Clinic this morning. I'm having a conversation with Dr. Chukwuma Okoli. We're talking about sickle cell anemia, raising awareness and, different genotypes. If you have questions that you would like to ask in that regard, do send it to 0904 422 2939. If you also want to call in, the number is 0909 888 9939 or 0912 222 2939. Via these numbers, you can reach out to us this morning with your questions on sickle cell. Now, there are new interventions. There's no cure as of this moment for sickle cell, but we've heard of new interventions, bone transplant. Is this similar to the one they do with a pregnant woman too?
Yes.
So explain.
It's bone marrow transplant. Yes, they try to get donor stem cells from bone marrows and then infuse so that if it survives, if it's successful, they will produce a new set of cells that doesn't have the sickle genome. And if that is successful, then such a patient can really be free to a large extent. But of course, know that there is not just one bone marrow that's in the body. You have the bone marrow in several bones, the clavicles, the tiny, tiny bones, the ribs, and then the end points of the big bone. So, but they will only transplant into 1 or 2 places, and hope that with this successful transplant, we can have increasing number of the non-sickle. Though other places we may still produce some sickle, but at least we have a new stem cell that is producing. And of course, it's not readily available to the common man.
When I was in school, when I was younger, I learned that there's
Who lived up to 80. That was one out of millions. Yes, he died at 80. In fact, we were preparing for his 80th birthday, and he just looked at them and smiled and said,
that's good.
I think I'm done. And so most times we've seen them, they don't actually cross the 60, but at least they do, some do up to 50. But of course, one thing is paramount, and that is
Money.
it takes a lot.
So it brings me to my next question. Can they independently take care of themselves? What I mean is, or you've been told that this is what, just as you've mentioned, take water, they have drugs, prescriptions that they take. Can they independently monitor themselves,
Yes.
or do they have to frequently come to the hospital?
Independently, no. They still have to go to the hospital. Now, what do you do in the hospital? The most important aspect is the whole discussion. The knowledge sharing is the most important aspect. So, ask questions, talk about anything, talk about everything. Yes, talk about your organs and the care of the organs. So you just learn the right thing to do. The drinking water aspect, which takes the blood, easily through the organs and the tissues, and every kind of food you should eat and what you shouldn't. So get the information and then use medications as you are asked to. The aspect that the individual plays is use this medication. If you are given, Daraprim, okay, let me use it. Folic acid, okay, let me use it. Okay, I need to treat this, I need to treat that. Then they go to the hospital and get this done. So it's a combination of the effort from the doctor and by the patient himself or herself.
Fair enough. All right, let's take a couple of questions. Remember, you can call in with 0909 888 9939 or 0912 222 2939. This is a message from Mohammed, and he says, "Good morning to you, Doc. I have never done a genotype or a blood group test, and I honestly do not even know the difference. All I know is for all the forms that I have filled up, I will always write AA and O plus. I think that's O positive.
Yes, so positive.
I think I was doing that at some point until I did mine. So let's even know the difference between, O positive and, the genotype. What's actually the difference between the two? Are they the same thing?
No, blood group is the blood types. It's just for the sake of if there is a need for a transfusion,
Okay.
a donation. Yes, to know the blood types. We have the A.
We take a lot of risks, so.
We
Wow.
have the A. We have the B. We have the AB and the O. We have the A negative, A positive, B negative, B positive, AB negative, AB positive, O negative, O positive. So that's the blood types. It's different from genotype. Genotype, genotype is basically to know the genome of the baby you are bringing forth. All right. So blood group, the only place blood group is important is if the woman is negative blood group, we have to be careful because of rhesus immunization. That one is a different topic for another day. Exactly. So the blood types A, B, ABO is different from the genotype that is AA. This genotype is always written in twos because you bring the genome from the man, the genome from the woman, and you combine. So if you are A, and then your wife is, okay, like you are AA, and then, okay, Vic Rich's wife is AA. So you give one A, she brings an A, your baby is going to be AA definitely. So for the number of babies you're going to have, all you're going to have is AA because both of you are AA. That's for the blood group. Now, that's for the
Genotype.
genotype. So the blood group is to say, okay, you are blood group A, your wife is blood group O. Then you now do the blood group of your baby to know which one did the baby pick. Did your baby pick A or...
Do hospitals do a test before that transfusion?
No matter the emergency, protocol is protocol.
Okay.
In fact, not even in this
Because
world.
when people just write on their file, O positive, I wanted to be sure that assumption is not taken to
Do you
play.
know that despite the fact that when we discuss with them and what's your blood group, I'm A positive, genotype AA, we still repeat it. We still repeat it. Some will be like, but doctor, I told you. I said, yes, you did. Let's do it. Oh, why are we doing it? Doctor, I don't have much money. Please, you need to do it. Let's be sure.
Fair enough.
Let's be sure.
All right, this is a message from Femi, and he says, "Good morning to you, Doc and Vic Riches. Not to rain on the parade of what the couple said, but my parents were both carriers, and they had 5 boys, no sickler. We had AS, 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 AA, AS. Going by medical possibilities, the fourth should have been a sickler, but nature is brutal as well as merciful.
Right.
Is that the case?
Right, yes. It's the chance. Yes, that was just chance playing out on them, and lucky them, really. Lucky them. And thank God. Yes, truly, he's right. He's right. It could have, at least one would have been an SS, but God is faithful. So let's leave it that way.
God is faithful doesn't mean that you should go and
Don't gamble with your babies. Oh. Your parents actually probably may not have even known about the genotype thing when they had you guys. So it's fine. God is faithful. He came true for them, and let's thank him.
All right. So how do you go about this test? Let's even talk about that. You just go to the hospital and
Yes, it's free. Just what I mean by that is enter an hospital and tell the doctor, I want to do my genotype. Oh, fine. They take you to the lab, take your samples, you pay for whatever it's cost, and you'll be called after a number of days. The results are available, and that is it. It's that straightforward.
okay, fair enough. Let's see. I still have more questions.
And are you also aware that some religious bodies do request for genotype before marriage?
No, I think that most actually would do that. Most religious bodies would do that.
Apart from blood PT for pregnancy, they'll ask the man to do genotype because they don't. Some churches have been implicated. Are you not the ones that joined them? Did you not know this?
That's right. That's right. I think that it should be. I think it should be a part of the constitution at this point, and people should be sanctioned for that. Because I think it's pure wickedness, to be honest. You're not the one that will deal with, whatever that child will have to go through. You might deal with it indirectly, but you will not directly understand what, the baby you're bringing into this world would, go through. So I think that at some point, maybe the government should enshrine, that in the constitution, and you'll be prosecuted if you get married to someone that will as difficult as it will sound, but
look at this video. I never saw what the lady said, but I'm surprised seeing that it's gone viral.
I'm just seeing it for the first time.
It's all over the Twitter.
Oh,
it's all over. I don't even know what happened, but that's just to tell you how the internet is a small place now.
Actually,
where anything that you put on it, before you know it, it goes all around.
Actually.
So that's why this video.
Oh well, Doc, I think it's the point that we're drawing the curtains here. So, your final words on this.
Yes, my final words to anybody out there who is a sickler or you are a hemoglobin SS, I stand with you 101%. And I would say that you should please make your health a priority. Listen to Solutions Clinic every Monday. You would never be wrong. Number 2, drink water. If I would actually
listened today, will take caution and precaution. Like I said earlier, it's very important that your first interview or date question should be, genotype before you're emotionally invested with the second party. It's something that you must consider. That way you're saving yourself some heartaches, so that you don't go loving up on someone, and when you're now doing proposal, how do you do that? How do you take that long shot? So please, it's very important that you ask questions, around genotypes and other health conditions, actually, not just genotype, before you decide to take that journey. Then if you now decide to, it's very okay to want to marry a carrier if you know that you don't want to have babies. These days, people, I hear statements like, I don't want to have a child. Like, people confidently say that. There are adoption. I think there are other mediums that you could, go for if you don't want to have babies. But please, don't go marry a carrier if you know that you intend to become, parents. That would be wrong. That would be pure wickedness, honestly. All right. Like I was always say, a healthy life. It's a wealthy life. Good morning to you. My name is Vic Riches.